was asked by my supervisor to find out why children who are Hispanic and black have higher levels of lead in their blood than white folks. It turns out that there are alleles that control the amount of material that is absorbed, such as lead, arsenic, heavy metals. Black children have two alleles that increase the absorption rate. Hispanic children have one allele that does and one that doesn't. And Caucasian children have the slowest rate of absorption. I found that extremely disturbing, and I wrote several memoranda suggesting that the levels we were setting that were acceptable of lead were unacceptable for blacks and for Hispanics because they would absorb more given the same exposure.
We are chemical systems. Toxins have such a huge effect on human behavior. And it's really important to understand this because the silicofluorides increase the absorption of the toxins. Lead levels absorbed by blacks in the United States are higher than lead levels absorbed by whites. A survey of children's blood lead, that's called the National Health and Nutrition Evaluation Survey data set, counties over 500,000 population, big cities. And if you look at this chart, you'll see that these are the blacks, these are Hispanics, and these are whites. And this is where there is no silicofluoride in the water, and this is where there's silicofluoride in the water. And you'll notice that there are two things that are going on. First of all, the blacks have higher levels of their lead than the whites. And where there's silicofluoride, there's higher level. But there's a third thing, which is the difference between these two graphs is bigger for blacks than it is for whites. To understand how it is that lead or silicofluoride should affect behavior and change the way we behave or think, you have to understand how the brain works just normally. We know there are some people who have learning disabilities of particular kinds, and that has to do with some part of that system really does not function normally. But let me just talk about the basic pattern of the system. You have these neurons or brain cells, and each one, when a current comes through or an impulse comes through, when something is released across that membrane, at the other end of the receptor cell, it's called the receptor, it's the equivalent of putting a plug in a wall plug, because when a chemical gets into this receptor, it fires the same impulse that was coming down that previous cell. If you have some lead in there, it can block the transmission, like putting chewing gum in a light socket. Lead interferes with dopamine, which interferes with learning, and then you have effects on the brain size, then you have lifelong effects. And if these effects are worse for poor children than for rich children, and I've got statistics that's the case, because poor children have less calcium in their diet. Lead and calcium have both the same electronic charge. They're divalent cations. They have an electric charge of 2 electrons. So you have a particular place in a protein, and there's supposed to be a calcium there. If there's no calcium, the lead can stick there, change the shape of the protein. The protein doesn't work. So there are a number of different pathways.
A friend of mine named Laura Seidel, who's very much involved with Captain Planet and many of the environmental issues around the country, called me and asked me would I meet with a man named Daniel Stockton and another person from the Lilly Center. So myself and Ambassador Andy Young met with them, and we looked at much of the information. We looked at what fluoride was doing to the teeth. We heard a lot of the information about this particular ingredient in our water and in our toothpaste. So consequently, we began to do a little more research on it, and we wanted to know how did it disproportionately impact on the people that we're called to serve in the African American community.
I became interested in the issue of disproportionate harm to minorities from fluoridation for several reasons. First of all, as a public health professional, I had done some minority health work in my career. I also saw in a publication called Morbidity and Mortality Weekly Report from the CDC, in 2005 they had some information that they shared, Buried in the back of this study that they published was a little table, and it showed that Black Americans and Hispanics had disproportionate amounts of dental fluorosis. And I was intrigued by this and disturbed by it, actually. And what a lot of people don't understand, because why would we know about this, is that alloys in brass and bronze and things like this, some of our plumbing fixtures, these plumbing fixtures have lead in them. And sometimes our plumbing lines have lead in them. So the fluoridated water, in some instances where there is the right chemistry in the water, can actually pull lead into the water. The fluorides can help pull lead into the water. So, maybe it's a little bit of lead, but the point is that any lead at all, this is something your body doesn't need.
Cholesterol, cardiovascular diseases, these are diseases which disproportionately impact the African American community. A lot of times it's because of diet. A lot of times it's because we get the information on health later than many other communities. So this is one we want to be the headlight instead of the tail light when it comes to the water that we drink. So this is why, and particularly in the South, because it is so warm, the humidity is so high, we tend to drink a lot of water. And so we need the best level of safety in our drinking water as possible.
As a public health person, I knew that the Black community and Hispanics and other minorities are disproportionately harmed by kidney disease and diabetes. Yet those were two of the populations that the National Research Council said were susceptible subgroups, particularly vulnerable to harm from fluorides. Then on top of it, I found, of course, and we've all known this, and a lot of folks in public health know that minority communities often have a poorer nutritional status. So when you add poor nutrition with added fluoride, the effect gets magnified of the harm from fluorides. Why has the public health community, and why has the medical community and the fluoridation, the supporting community, why have they not actively shared with minority communities the whole story about fluorides? If fluorides are so safe and good and mom's apple pie and all American, then certainly they would stand up to some kind of scrutiny and closer examination. But when I began to address minority health departments in government agencies, for instance, in the state of Tennessee, I was told that the minority health folks would not talk to me anymore. And then we began to approach this issue with the Centers for Disease Control and other places around the country. And over and over and over again, we found out that when we posed the question about how do we reach out to the Black community, how come the Black community hasn't been told, the leaders of the Black community, etc., we got silence, or they changed the subject. Even United States senators and representatives wouldn't pursue this subject. It's one of those things that nobody wants to touch with a 10-foot pole, because the facts are minorities are disproportionately harmed by water fluoridation and other fluorides from other sources.
It's been stated to me that if we come out and speak about these issues in terms of fluoridated water and the impact, that there might be people in higher up positions that might become somewhat angered, disgruntled. People might say that they don't have all of the facts, and I wouldn't argue with that. We don't have all of the facts, but they said that if you begin to speak out against this, it might get a little heat might be put on you. And I said that if you can't stand the heat, you need to get out of the kitchen. And I think that that's quite important, that for those of us who are beginning to try to understand this, that we raise the pertinent issues that can improve the lives of our children and those that we're called to serve.
There is very little information that is made available to members of the minority communities. And let's be honest about it, there's perhaps less access to computers, or maybe less access to the internet. And maybe there's issues with second languages and primary languages. So my concern was, we're all Americans, and it seems to me that all Americans deserve to hear the whole story about fluorides, not just the benefits, but what about how this affects members of the Black community, or Hispanics, or American Indians, or other or Asians. So we began to push this story, and over again we met with resistance. The good news is the thing is cracking open now. Members of the Hispanic community and the Black community have been given this information, and they're waking up to it and saying, this is just not right.
We as a people, must be concerned about the welfare and the health of all people. There are certain issues that tend to get swept under the rug. We've got to lift the rug, look at these issues for the good of the people. One of those is fluoridated water and what's in water. And we've got to, in some way, get all of the research necessary and remove it if it is detrimental. I tend to believe that it is harmful. So if we're to make a difference, we've all got to come together. We've got to come together as parents. We've got to come together as clergy. We've got to come together as science. We've got to come together as legislators and medical profession. We've all got to come together. And if we all can come together around this issue, we can find out where the truth is. And if we can find out the truth, then we can make a difference. And I think that that's what we're all called to do. I think everybody in this, whether they're on one side or the other on the issue, we're all concerned about how do we become a healthier people who can really have a beautiful smile like this.